In 1879, a young Scottish medical missionary named Robert W. Felkin arrived in the Bunyoro Kingdom, a powerful and innovative state in what is now western Uganda. Sent by the Church Missionary Society, Felkin was tasked with documenting the customs and practices of the Banyoro people. What he witnessed there would challenge everything Europeans thought they knew about medicine. Felkin observed a cesarean section performed by indigenous Banyoro surgeons, a procedure that successfully saved both mother and child. At a time when Europe struggled with high maternal mortality rates during such operations, this practice stood out as a testament to advanced medical knowledge in pre-colonial Africa. Felkin's account, published in the Edinburgh Medical Journal in 1884, offers a rare glimpse into a sophisticated blend of surgery, pharmacology, and spirituality. This is the story of a forgotten medical marvel, a history that defies stereotypes and rewrites our understanding of Africa's contributions to science. It is a story of innovation, resilience, and the enduring quest for knowledge, a story that deserves to be remembered. Act 1. The Bunyoro Kingdom, a hub of innovation. To understand the significance of the cesarean section observed by Felkin, we must first explore the Bunyoro Kingdom, one of Central and East Africa's most powerful states from the 13th to the 19th centuries. Located in modern-day western Uganda, Bunyoro was a center of political, economic, and cultural innovation. Under leaders like Omukama Chwa II Kabalega, reigned 1870-1899, Bunyoro resisted colonial encroachment and maintained its independence through military prowess and strategic alliances. The kingdom was renowned for its achievements in metallurgy, agriculture, and medicine. The Banyoro people, who inhabited the region, were skilled blacksmiths, weavers, and healers, with a deep understanding of their environment. By the time Felkin arrived in 1879, the Banyoro had developed a sophisticated medical tradition that included surgical procedures, herbal remedies, and preventive practices. Cesarean sections were not a novelty, but a routine procedure, performed with precision and care. This stands in stark contrast to Europe, where such operations were a desperate last resort, often resulting in the death of the mother. Act 2. The cesarean section, a detailed walkthrough. Felkin's eyewitness account provides a vivid description of the cesarean section he observed in Kahura, a village within Bunyoro's domain. Here's how the procedure unfolded. Preparation and anesthesia. The patient, a healthy woman in her 20s in her first pregnancy, was positioned on an inclined bed. Her body was secured with bark cloth straps around her thorax and thighs to limit movement during the surgery. She was given banana wine, a fermented drink with alcohol content, which served dual purposes. It semi-intoxicated her to dull pain and acted as an antiseptic wash for her abdomen and the surgeon's hands. This use of a local resource highlights the Banyoro's practical pharmacology. The surgical team, 3 individuals, collaborated seamlessly during the procedure. The lead surgeon, who wielded the knife with precision. An assistant, who held the mother's ankles to stabilize her. Another assistant, who supported her abdomen, likely to manage pressure and assist with retraction. This division of labor reflects a well-practiced codified technique honed over generations. The incision. The surgeon made a swift midline incision from just above the pubis to below the umbilicus, cutting through the abdominal wall and uterus in one motion. Amniotic fluid spilled out, signaling that the uterus had been breached. Felkin noted the speed of the incision, which was critical to minimize blood loss, a detail he admired. Delivery and hemostasis. The assistant hooked 2 fingers into the uterine incision to widen it, allowing the surgeon to extract the baby. The umbilical cord was cut, and the newborn was handed to an attendant. Bleeding was controlled with selective cauterization using red-hot irons, a rudimentary but effective hemostatic technique. The uterus was massaged to encourage contraction, reducing postpartum hemorrhage, though it wasn't sutured, a contrast to later European methods. Closure and wound care. The abdominal wound was closed with 7 iron spikes, driven through the skin edges and secured with bark cloth string, akin to early surgical staples. A paste made from pounded roots was applied as a dressing, followed by a warmed banana leaf and a firm mbugu, bark cloth, bandage. This herbal poultice likely had antiseptic or healing properties, showcasing the Banyole's deep botanical knowledge. Post-operative care. The mother rested comfortably within an hour. The baby nursed within 2 hours, though if her milk was delayed, a noted side effect, community women breastfed the infant, a testament to the communal support system. Wound dressings were changed on the 3rd, 5th, and 6th days, with pins gradually removed. By day 11, the wound had healed fully, with minimal pus managed by pulp sponges. Act 3. Tools and materials. Innovation from local resources. The success of the cesarean section relied on the Banyole's ability to leverage local resources. Knife, a locally forged blade, sterilized by heat or banana wine, sharp enough for precise cuts. Banana wine, a fermented brew from Uganda's abundant banana crops, used as both anesthetic and disinfectant. Iron spikes and bark cloth, simple yet effective for wound closure, reflecting the Banyole's blacksmithing and weaving skills. Herbal paste, a root-based concoction, possibly with antimicrobial properties, showcasing deep plant knowledge. Red-hot irons, heated metal for cauterization, a practical solution to bleeding control. These tools and materials highlight the Banyole's ingenuity and adaptability, demonstrating that advanced medical practices do not require complex technology, but rather a deep understanding of available resources. Act 4. Cultural and spiritual dimensions. The cesarean section was not just a medical procedure, it was a cultural and spiritual event. The surgery began with incantations, integrating spirituality into the healing process. This holistic approach served to calm the patient and invoke communal strength. Bark cloth preserved the patient's modesty, showing respect for her dignity amid a public procedure. These elements suggest that medicine in Bunyoro was inseparable from cultural identity, a stark contrast to the clinical detachment emerging in Europe. Act 5. Comparison to Europe in 1879. In Europe, cesarean sections were grim affairs. Mortality. Mothers rarely survived due to sepsis, as antiseptic surgery was still in its infancy. Joseph Lister's antiseptic techniques, using carbolic acid, were only adopted in the 1870s, and hand washing, pioneered by Ignaz Semmelweis, faced widespread skepticism. Technique. European surgeons often chose between mother and child, lacking the precision and hygiene of Bunyoro's method. Anesthesia. Ether and chloroform were available but not universally used, while Bunyoro's banana wine was a local, accessible alternative. Bunyoro's practices, hand-washing, sterilization, and teamwork, paralleled or predated European innovations, achieved without external influence. The kingdom's isolation until the 1850s, first contact with Zanzibaris, and 1862 Europeans, reinforces this as an indigenous development. Act 6. Broader medical expertise in Bunyoro cesarean sections were not the Banyole's only medical feat. Inoculation. They practiced protective inoculation against endemic syphilis in children, akin to early vaccination. Other surgeries. Evidence suggests cataract surgeries using plant-based anesthetics, indicating a broad surgical tradition. These practices reflect a systematic approach to medicine, rooted in observation, experimentation, and refinement. Act 7. Reception and Legacy. Felkin's report, delivered in 1884, met shock and skepticism in Europe. The idea that Africans outperformed Western surgeons clashed with colonial prejudices. Yet Felkin, who later became a respected tropical disease expert, stood by his account. His detailed notes and sketches were validated in 1957 by Jack Davies, a pathologist in Uganda, affirming their accuracy. This legacy faded under colonial disruption. Modern Ugandan maternal mortality rates starkly contrast with Bunyoro's past success, prompting questions about lost knowledge. Today, scholars and advocates push to reclaim this history, seeing it as a source of pride and a challenge to rethink Africa's role in medical innovation. Conclusion: rewriting history. The Banyolo's cesarean sections highlight Africa's contributions to science, predating and surpassing European parallels in outcome, if not technology. This story is not just a chapter in medical history, it is a call to remember and celebrate the diversity of human achievement. It challenges us to rethink our assumptions and to honor the forgotten pioneers who paved the way for modern medicine.